Good afternoon, everyone. Thank you all so much for tuning in live or catching a recording of this later on. It is National Poison Prevention Week. So for those who don't know about this week, it's pretty cool. It's where all poison centers across the country, we get together, we celebrate all sorts of hoopla around poison prevention. And I literally just learned Washington Poison Center has been engaging with this week, celebrating this week for over 60 years. And that's just really cool. So let's dive right in for this session. Rather than going through poison prevention strategies and showing you data about what we see and what we hear, which is all awesome and useful, we are going to take a step back. We're going to give you a glimpse inside the poison center. So this last year, 2021, has been so very hectic, so wild. We've still been dealing with the COVID-19 pandemic. Our phones have been on literally nonstop. We're going through, and even though we've still been working remotely, we're still taking those calls. So enough of my rambles. Let's dive right in. I'd like to introduce Dr. Scott Phillips. He is our medical director, and Dr. Marlo Murray. She wears many hats at the Poison Center. She's what we call a C-SPI. That's a certified specialist in poison information, as well as one of our call staff leads. So thank you both so much for joining. I'm going to just start with the question. So Dr. Murray, let's start with you. How did you get started with the Poison Center?
Well, I got my start as a student way back in 2008, and I was in pharmacy school, and I did an internship at the Poison Center for about a year and a half taking calls. So that was my introduction to the Poison Center, and I really liked what I saw. It's a very unique pharmacy practice, much different from retail pharmacy work, which I was used to. And then I've been a pharmacist since 2011 with the Poison Center. I became a certified specialist in poison information in 2012, and the years go on. So about 11 years as a pharmacist and another year plus as a student.
Well, excellent. Dr. Phillips, how about you? How did you get started with the Washington Poison Center?
Well, I got started Washington Poison Center probably about 5 or 6 years ago now. I've been at the Rocky Mountain Poison Center for over 20 years in Denver and moved back to Washington State where I was born, and was asked to help out by the executive director at that time. And then got asked to become the associate medical director. And then the last year I've been the medical director. So it's been a exciting journey here in the matter of a few years for me.
So Dr. Phillips, you've had some extra spice thrown into your 2021.
Yes, sir.
So let's see, for Dr. Phillips, let's start with you on this one. This is kind of an obvious question, but what's been different about this past year other than donning the medical director hat?
Yeah, well, that's probably the biggest thing for me. It's been a lot more responsibility wearing the medical director hat, and many more hours of work, and not just medical direction, but also helping out on the management side of the organization as well. So it's been very busy for me, getting involved more and more, and I'm hoping this next year is even busier, but we can get more face-to-face with the public.
And folks, it doesn't help Dr. Phillips that us educators keep pulling him into these live streams and interviews. Dr. Murray, how about you? What has felt different about 2021 compared to?
Well, I think we all expected the pandemic would be winding down in 2021, and surprise, it's still gone on throughout 2021. We all worked remotely throughout the entirety of the year in 2021, and that means all of our work was remote, including all of our teaching. And we teach a lot of students and residents and EMT students, lots of folks who normally would be coming into the Poison Center. We've had to make some adjustments in order to do that learning and that teaching remotely. So it's had some unique challenges, but we've been able to get creative and work out some strategies to allow us to continue teaching. So that's been really, really cool.
So Dr. Murray, even with all these unique challenges of training remotely and all that, what's felt the same? What's been the same?
Well, we're still taking calls. Nothing really has changed about the actual work we're doing. We're still taking calls. We're still serving all of the folks in Washington 24/7 every single day. taking calls, answering questions about poisoning, about medications, household products, chemicals, all kinds of things. Our work really has stayed the same. It's just our location might be different. We're sitting in our homes rather than in the office together. So we're still doing that poison center work that we've always done.
Wonderful. Now, another question for you, Dr. Murray, is, you're taking calls still throughout all of this. You personally have been taking calls throughout all this. What has felt different, if anything, about calls in this last year compared to previous years?
Well, I don't know, the pandemic, it's really not over yet. And I think it's really important to keep in mind that people are really still struggling out there and going through a lot of challenges with their work life, and they may have young kids with them at home. They may be working from home. They may be transitioning back to a workplace that they haven't been to in over a year. So people are in a state of transition. And so a lot of our calls are maybe some the same, maybe some different, but I think just keeping that in mind that we're still kind of in pandemic mode and evolving through the pandemic, right? It's maybe not the same as it was in 2020. Even now, today in 2022, things are looking different. So just keeping up with that and knowing that a lot of people out there are doing some, when they're calling us, they may be experiencing some unique challenges because of the pandemic. It's still impacting their lives.
Absolutely. Anything you'd like to add to that, Dr. Phillips? Any trends you've noticed? Anything different in 2021?
Well, I think there have been some trends. I think thinking about what's remained the same, I think as Dr. Murray said, we're still meeting our mission. We're preventing and reducing harm from poisoning every day. And as a nonprofit organization, that's difficult because we also have to work to keep the doors open and feed everyone. So that's kind of all remained the same. I think one thing that has changed is the complexity of the cases. We're seeing more and more cases coming from hospitals or healthcare facilities, and these people tend to be a lot sicker. And that's been a real issue for our staff because, we all have to increase our level of training and our awareness, and it's not just, little kids at home taking a taste of something anymore. These are some really sick patients in critical care units and emergency departments that take a lot of time. And so time has been a big issue for us, and trying to help the providers there and the families deal with this.
Yeah, that's a good point. We have to evolve as our clinical knowledge has to evolve as our patient care evolves too.
Yeah.
You both bring up some excellent points that the field of toxicology, that's the science behind poison center calls and how you guys help folks, is always growing and changing because the products that we're exposed to, the substances we're exposed to are always growing and changing. Let's see. Now, for those who don't know this, so we, in addition to our main poison helpline, that's 1-800-222-1222. This is the number literally anyone in the country can call anytime. We're always open. We're going to help you out. In addition to calls from everyday folks, we get tons of calls on our back end from healthcare facilities, from emergency rooms. And that's a lot of what both Dr. Phillips and Dr. Murray were just referencing, is the complexity of those calls. Even if the total number of calls may not increase, the complication, the complexity of those calls can just really add so much time and energy. So that's something that a lot of folks, I certainly didn't realize before working with the Poison Center, that we took calls from emergency rooms and emergency departments. All right, let's see. I'm keeping track of my questions here. So the past 2 years, there's been so much rhetoric about this idea of the new normal, how things will change, throughout and hopefully someday post-pandemic. So I'll start with you, Dr. Phillips. What do you hope will remain a part of this new normal, or will become a part of this new normal?
Well, I think I like to think about that in terms of some of the trends that we've witnessed in the last year, particularly, and really during the pandemic. And that would be that there's a lot more adolescent misuse and suicides. And there's more seniors with medication errors or misuse that's going on also. So that's part of what Dr. Murray was saying. We have to adapt to that and deal with that. And that's something I'm hoping is not becoming our new normal. What I'd like to see is more public involvement as we come out of this, hopefully come out of this pandemic at some point, more in poison prevention, more in preparation by the public. Providers are already up to speed on prevention, but we need to get more to the communities. I want everybody that can to get CPR training, and in areas that where there's any risk to have naloxone available, and have the Poison Center 800 number readily available, plugged into their telephones. And that's really what I hope the public really takes a hold of this and learns, educates themselves, becomes aware, and is ready to help those adolescent cases that are increasing and the seniors that cases seem to be rising in certain areas.
Now, Dr. Phillips, do you mind explaining what misuse is? Because I know that that's a term that can be a little confusing to folks who are outside of the poison coding world.
Yeah, misuse, Dr. Murray probably has a better grasp of this because it has very specific coding notations. But we think of misuse as using a medication not how it was intended. Right, so it could be an extra medication. It could be taking it for the wrong reason, taking somebody else's medication. Hey, try one of mine. Maybe that helped me. It might help you. So there's kind of a lot of subtleties to that. But Dr. Murray has some very strict criteria we use because we capture all of this data so it can be followed on a national level. And so there's some really specific terms for that. But in general, it's not using the medicine as it was prescribed.
Yeah, and that can include chemicals or other household products too, not just medications, but using something in a way other than it was intended. So you have directions on a package. If you're not following those directions, that's using it in a way that it wasn't meant to be used. That's misuse.
Perfect. Thank you. Now, I'll ask that same larger question to you, Dr. Murray. What do you hope becomes a part of this new normal?
Well, we've seen virtual care visits and telehealth become more and more common throughout the pandemic and more accessible. And I think that's really great. It's a low-cost way to utilize technology to reach a provider. And so I really hope that trend continues because it's a way that you can, within a few moments, talk to someone, talk to a healthcare provider and get answers. And the Poison Center is kind of cool in that we are sort of the OG telehealth, right? We've been over the phone forever, and you can reach us right away too. And that's just so cool. So I hope that trend continues.
And we're free.
Absolutely. I was literally going to say that same thing. And that's something, a lot of folks, I think, are uncertain. Should I call the Poison Center? Should I call 911 for any given situation? And our general guidance with that is if it's following a poison emergency and the person you're calling for is so long as they are conscious, breathing, and not having a seizure, please call us. And if the case is severe enough, we will tell you to go to the ER. We absolutely will redirect you that way. And we're able to keep most of our callers at home. So that's not just a very long and stressful visit to the ER you can avoid. That's also a lot of money you can save. And you'll never get any sort of billing questions from us or anything like that. Now we're speeding right along. We're getting close to our 15-minute mark. It's okay if we go a little over, but I think we're at our end point. So I'll start with you, Dr. Murray. Is there any final important message? Any thoughts you'd like to leave for our viewers as we're still battling through COVID-19?
Yes, I just want to piggyback on what you said about keeping folks out of the hospital, out of the emergency room. Emergency rooms, hospitals remain really busy and overburdened with COVID patients and COVID care and all the things going along with COVID. And you can help to prevent a trip to the emergency department by preventing poisoning. And that's Poison Prevention Week, what it's all about. So just a reminder to keep your medications stored safely, locked up, out of reach, keep household products locked up, out of reach, read and follow package directions for household products and your medications. And then if a poisoning does happen, call the Poison Center. And if you haven't programmed it into your phone yet, please do so now. Again, it's 222-1222 24/7 every day. And like Alex said, it's free. So that's my take home point.
Perfect. How about you, Dr. Phillips? What final thoughts?
Well, I think the thing I want people to realize, we've seen a lot of increase in opiate-related deaths, and particularly with fentanyl and some of the more ultra-potent opioids and opiates. And so with that, I really want people to realize that they should be prepared. Again, no CPR, have naloxone available to you. If it's available, it's called Narcan is one of the trade names. And to call the Poison Center with any questions. Don't feel like it's a stupid question. Please call us and we'll help you work through it.
Absolutely. And folks, I promise you, the call takers at the Poison Center, Dr. Murray included, they've heard stranger stories than yours. We are a very judgment-free zone. We never want someone to not call us because they're embarrassed or because they're ashamed. Our whole point is not to tattle on you or anything like that. It's to keep you safe. Well, folks, I thank you so much for joining today. I love when we can do these streams together. And stay safe, everyone. Call the Poison Center whenever you need, and have a great rest of your day. Take care.